Good afternoon. This is Damian David with Cornerstone Advisors, and welcome back to my week in review. Been doing this for 4 weeks now, so this is the fourth one. Just like all the others, in the description section, there's some links, some information, basically a review of the headlines that I'll review here. The idea here is that we're taking 10 or 15 minutes. I'm going to review some of the headlines, some of the latter things that I'm hearing throughout the world of COVID-19 and coronavirus, cutting to the chase. Getting rid of all the noise, just bringing to you what I think is important, that I think you should be tuned into, including some updates on things that we've been covering for the past week, 2, 3. Then the second segment, I call up upon my colleague Alex Atkinson. He's going to talk to us about how he's helping some hospitals and healthcare systems handle their training strategies in the times of COVID-19. So leveraging technologies, leveraging some remote learning capabilities. Things that we've been resistant as an industry in the past, like anything that hasn't been in-person classroom setting type of training and education, we're not able to do that right now. So all rules are off. So it kind of breaks us free of some of the different anchors and some of the different limitations that we've had in the past, opens up a whole new world of different things that are available to us. So not just now, but what we see, and we'll talk about it, how we think it's going to impact the industry from here on out. So, now that we've made the strides and we're able to do this, we're not going back, right? So great conversation with Alex. I was glad to have him. His information's in there as well, a visual of his LinkedIn. Go link up with him on LinkedIn. He's a great resource. He can really help you in the world of not just training, but again, he's like a project manager, program manager that has really good understanding how clinical workflows are impacted throughout the project. So he's a good 1-2 combination, a wealth of knowledge and expertise there. So reach out to him. And then after Alex's conversation, I leave you with some beautiful visualizations, an escape from your reality at this point. Again, myself and my colleagues at Cornerstone, we're greatly appreciative, and we have a lot of gratitude for you and the work that you're doing to keep your community safe and healthy. So take care, sit back, and let's get into some of the headlines. All right, May 5th, 2020. So job loss, that's in dealing with that as a country, that's something that's on our radar. We're seeing our friends, families, et cetera, suffering some job loss. Unfortunately, healthcare is being affected by that too. So we're all in healthcare. Healthcare is now second only to the restaurant industry as far as numbers when it comes to job loss. So things such as, the delay and the cancellation of elective procedures and elective care, downflux in some of the patient volumes, people not wanting to schedule or come into the healthcare facilities for fear that they'll be exposed to coronavirus. These are all impacting the industry, and unfortunately, again, we're second only to restaurant industry as far as job losses. So hopefully we can get a grip on this. Most recently, Allina Health, they're one of the latest to announce furlough and reduction plans in their organization to accommodate being able to buffer against these situations and the loss in volume of activity. Second headline, the U.S. starts to reopen its businesses to the public. This is kind of, again, I hate, as I said before in prior weekend reviews, I don't like the political aspects of it. I don't want to get involved with that, but I do have to say I'm a little bit worried as we start to hit numbers and we start to hit our swell. So in the Midwest, where I live in Nebraska, as an example, we're now number one as far as new confirmed cases of COVID-19 in the nation. And right now we're starting to open up the malls, restaurants, and that's, other states are following suit, other areas throughout the country are doing the same thing. So I'm alarmed at that. And I'm hoping that, we don't lose control because we're opening businesses again. More news on that. I'll definitely keep my eye on that. That's something that I'll want to be sure to monitor throughout the week. So stay tuned for an update on that. Speaking of updates, the update on the antibody tests. So Dr. Fauci had announced that they're available weeks ago, maybe even on my first week in review. The standards that the emergency program puts into play are substandard. So they've actually gone ahead this week and stiffened some of the rules around that. So they're trying to boost some of the quality. There's over 250 developers now introducing products into the industry. So of those, we don't know if any of them are effective. Another story I've been following for the past couple of weeks. If you remember, Smithfield had over 200 employees test positive for COVID-19. They started closing plants down, closed 3 or 4 of their plants over the past 3 weeks or so. Tyson started to in response to COVID-19. They're starting to reopen these plants just a week later. So they're taking some precautions as they open them, but more to come. That's another thing that I'll keep on monitoring there as well. On another note, as far as large retailers, J.Crew's the first large retailer casualty of the coronavirus COVID-19 pandemic. They filed for Chapter 11 bankruptcy earlier today, this being Monday when I filmed this. Not sure if we'll see this to be a trend, but again, we've had our first large retailer casualty. Big Ten Conference suspends organized team activities through June 1st. So May's gone, right? So they've suspended all activities through May, and then they're going to reinvestigate and they're going to reassess when we get through the end of May whether or not they'll continue that and suspend into June or not. The U.S. Supreme Court, for the first time in U.S. history, they're doing it remotely. So they're streaming and live streaming between the different justices some of the information needed for their day-to-day functions and their decision making. So interesting, even the U.S. Supreme Court has been impacted by this and are operating in a remote capacity. Last week, I had brought to your attention that New York hospitals were doing clinical trials around possibility of famotidine, which is the active ingredient of Pepcid, being used to fight COVID-19. We don't have any results yet on whether or not it is effective, but what we can tell you is just since the announcement last week, consumers have bought up all of the Pepcid, creating a shortage. So it's all on backlog, and as of now, we still await the results and findings of the tests. All right, get us to the stats. Week after week, I've been actually reviewing the statistics of COVID-19 coronavirus, both at the world level and then specifically in the U.S. as well. Again, not to be doom and gloom. I just think it's important to track the numbers so that we can be aware of how it's impacting us in the world. So this week, as of the recording of this, which is Monday, May 4th, the world has 3.5 million confirmed cases of COVID-19. Last week, we're at 3 million. So it's increased about 500,000 cases globally. Of those, this week, 1.13 million have been reported to have recovered, whereas last week it was just 879,000. So great strides in actually improving the recovery from COVID-19 throughout the world. The death statistics. Globally, we've had 248,000 deaths from COVID-19. Last week, we sat at 208,000. So there might be a trend. The trend might be that we're slowing the deaths week after week, which is a good sign. I'd like to see that slowed even more, though. So we'll keep our eye on that over the course of this next week. For the United States, this week there have been 1.2 million confirmed cases in the U.S., whereas last week, at the time of filming, we had 999,000. So a little bit of a bump there. Of that, the recovered cases this week is sitting around 159,000 recoveries. Last week we were just at 110,000, so that's 49,000 more recoveries this week. That's a good sign in my eyes. The death statistics in the country, U.S., this week we're at 69,195 deaths from COVID-19. Last week we're at 56,035. So the week before that, we were at 41,300, and the week before that, we were at 23,068. So I am seeing a decrease in the trend for the deaths, which might be a good sign. I'd still like to see it slow more dramatically over the next coming weeks. So more to come for those. Those are the headlines for this week. Let's get into it. Let me see if I can drum up Alex Atkinson. Stay tuned. Hey, Alex, how you doing today?
Doing well. How are you, Damian?
Good. I'm doing great, thanks. Hey, everybody. This is Alex Atkinson. He's joining me from Albuquerque, New Mexico. He's one of our managers in the Epic practice. Alex, you're not just another project manager. I know, especially you also have quite a bit of experience on the workflow analysis side. So everything that you run is not just to get the job done within the constraints of a box of time, so to say. You do it also with a lot of care to making sure that you're doing it the right way, that it's going to get used. People are going to be happy with the end results, folks that actually have to use it day to day. So that's just a little bit of background of Alex. Before we get into it, Alex, how you holding up?
I'm pretty good. I've been working from home for, I guess, a little over a month now, which is rare for me. But it's been good. My wife and our dogs, I think it's been the best for the dogs, considering that we're both home all the times of the day. So it's plenty of walks, plenty of playing time for them. So, but it's been good. We're making the most of it.
Well, good. I'm glad to see that you guys are staying safe. I hope that continues. So COVID-19 it gives us a unique scenario, so to say. It's definitely impacting a lot of different industries, healthcare, hospital systems, things that we do on a day-to-day basis. It's kind of breaking everything out of the mold, right? There's
Right.
traditional approaches. There was a lot of rules and norms. Those have totally gotten completely shattered. So, you and I were talking the other day about what you're doing with some of the training in the programs that you guys are coming up with in regards to training around EHR systems, et cetera. Tell me, can you talk a little bit about that? What you're forced to do for COVID-19, and then what you think will live on beyond that?
Yeah, absolutely. I mean, when we talk about training in the really any EMR, EHR space, the question has always kind of been out there of how do we make this self-paced? How do we make this kind of a user-led training instead of an instructor-led training? Something replicable, something that they could do when the end user has free time, instead of making them, sacrifice an entire shift of work to attend a training class. And I think that COVID has kind of pushed hospital organizations towards that in kind of a need scenario, and saying that we can't have 15, 25 people in a classroom working 6 inches apart from each other. It's obviously just not possible with the current situation. So there's short-term solution is kind of, well, I guess we're going to have to do this one-on-one training with everybody and just do like Skype sessions, kind of like this right now, except with Epic or Cerner or Meditech training, anything like that. It's kind of lit a fire under hospitals a little bit to say we need a solution that's going to be sustainable in the long term. Because we can manage short-term solutions, we can manage doing Skype sessions, but that's really not something that we want to be doing for the long term. So a lot of my focus has been trying to establish what are those long-term solutions, what have I done in the past for self-paced learning programs and things like that.
Yeah, so I don't want to give too many of your bag of tricks or secrets away, but I do want to mention, if people are interested in finding out a little bit more of the specifics, like, do you use a certain platform or do you have suggestions around LMS or whatever direction route of deployment that you have to go through? I welcome everybody. I'm going to put Alex's contact information into the description on the YouTube channel for this video. So I welcome you to reach out to him or reach out to me. I can make the connection in that regard. Yeah, interesting stuff. I think, what we probably wanted the whole healthcare to embrace years ago, this kind of forces the hand, right? So it's really interesting to see it come to fruition. Glad you're at the forefront of it. Exciting stuff. I see this lasting well after COVID-19 for sure. So
Yeah, absolutely.
yeah, good for you. Appreciate it. All right, so hey, tell me about May 14th, what you got going with Ryan.
Yeah, me and Ryan Summers, one of the directors for the Epic practice, are co-hosting a webinar session to talk about just that, on-demand training, self-paced learning programs, ways to adapt to both the COVID-induced situation that we're in from a training perspective and the long-term solutions that come off that.
Cool. I got one more question for you. You ready?
Yep.
All right. If you could meet anyone, whether it be from history or somebody that's currently living now, and you could spend an hour with them, who would it be and what would you do?
I think that, off the cuff, I would say Alexander the Great comes to mind, just because he's such like it's probably a little bit of a generic answer, but he's such a bizarre character in history, and a lot of positive attributes, a lot of negative attributes. Just depends on who you ask, and I'd kind of like to hear it from the source, I think. So just get a good picture of him and who he was would be interesting.
Fascinating. So what would you do?
I don't know. I think probably have coffee. Coffee. I'm
Coffee?
not sure if the Macedonians were coffee drinkers, but probably coffee.
Yeah, I like coffee. Well, hey, thanks so much for joining me. Appreciate it. Again, stay safe. Keep doing what you're doing. Great work. And yeah, look forward to hanging out with you as soon as this thing all blows over. So
Sounds good, Damien. I appreciate it.
thanks. Take care.
You too.
Well, that was great. I'm always happy to talk to my colleagues during these weekend reviews. I especially glad that I got a chance to speak with Alex for a few minutes. If training strategy, if you're interested in that, or if you're interested in how you can tie some improvements in your clinical workflow for your EHR, let me know. Reach out to Alex. Again, I provided his information in the description below. Link up with him on LinkedIn, or I left his email as well. You feel free to email him. If for some reason you'd rather go through me, go ahead and reach out to me, and I'll make the connection there for you. Okay, so I hope you had a great week. I hope you stay safe. I hope you stay energized. Truly appreciate what you're doing for your communities and our communities and in the country and the world. So keep it up. Stay safe. We'll see you next week. Here's a couple of visions we just want to give you a little bit of an escape from your reality this week. So here it is, some sailing away. Take care.
Come away with me in the night. Come away with me and alright. You, a song. Come away with me on a bus. Come away where they can tempt us with their lies. And I wanna walk with you on a cloudy day in fields where the yellow grass rolls knee high. Won't you try to come and come away with me, and we'll kiss on a mountaintop. Come away with me and I'll never stop loving you. And I wanna wake up with the rain falling on a tin roof, with you lying safe here in my arms. All I'm asking is for you to come away with me in the night. Come away with me.